But we've talked about drugs and we've talked about that kind of stuff. So this bit basically is to talk about how you would support people into a service which can help with that. So we are Turning Point. Turning Point took over the drug and alcohol service on the 1st of April. We're an integrated service, which basically means we do it all. We work with young people, adults and families and carers, and we work with people within the criminal justice system. So it's one door in, and basically the idea is that behind that door we will find support for you. So I'm going to see where the technology is, my friend. Normally I go the wrong way on these things, but look, here we go. So this is the model. It makes it look incredibly complicated, and it makes it look like I would get lost in there, but to be fair, I can probably get lost coming here. So the idea is that the first bit of the model is the out there everywhere. The idea is that there are lots of people in our communities who know that they have a drug and alcohol problem, who want support, and so come through our door already. It might be that their social worker calls us, it might be with young people that they come in themselves, GPs, lots of different people refer in, but we know who those people are, they're already there. The idea of this is there are loads of people who don't know that they need help, and the idea that we are trying to get them into service and support them so that they don't get to a point where they need critical care. We don't get to a point where they're going into A&E on a Friday, Saturday night because they're off their faces and psychotic. So, in this bit here, we look at supporting people. We use air sports, I'll talk about them more later. We use recreational outreach. That is the bit that Ren was talking about earlier, the new psychoactive substances. What we want to do is we want to find ways, those people, as Ren said, are buying online. They're using it in a really different way. They're staying at home, they're having fun with their friends, they're drinking expensive wine, and they're getting off their faces, but they don't recognise sometimes the damage, and they don't ever get any of the education they need. So we're looking at professionals who wouldn't fit into normal services. So people who are misusing or abusing alcohol, but actually that, I'm only drinking 4 glasses of wine a night, which is, in some standards like a bottle and a half of wine, and not recognising the detrimental effect that can have. So we need to look at how we support those people. There's a whole other section, which is smart muscle, which, as you can imagine, is looking at those drugs which people use to enhance their physical appearance. So steroids, but also all of the other bits and pieces that come with that. Those people don't think that they have a drug problem or need support from a drug service. So it's about us finding a way to support them in as well. So my team do this bit. This is what we do. So I run the youth service and I run the engagement service. The youth service is pretty much what it sounds like. We work with young people. So we work with young people up to the age of 25. We do that because we recognise that if we're dealing with people who've come from homes where home life hasn't been great, or they're young people who've been in and out of care, they sometimes have poor attachment, and if they have poor attachment, sometimes their ability to move on into adulthood is delayed. So by being able to go up to 25, it gives us the ability to do that little bit of extra nurturing while they're just about getting their stuff together. To be fair, when I left for uni at 19, I don't think I even knew how to turn the washing machine on, so I probably would have needed a service that went to about 35, to be fair. So that's what we do. The youth service work with young people anywhere in the county. We will go and do visits anywhere that suits a young person. We don't expect them to come to us because it's a big place, they've got no money and they don't travel very well. So we've met people in McDonald's, we do home visits, we'll meet them in schools, youth clubs, that kind of thing. We don't work traditional hours, so we can go and see people in the evenings as well. We are confidential, so we won't definitely tell their parents, but we would support them to get to a point where that conversation was something they wanted to have, because the support from a family is the thing that's going to maintain their good behaviour, their sobriety, their ability to make more sensible choices. So we offer one-to-ones, and that service goes on for as long as it needs to, basically. We look at building resilience in that young person, building their ability to look at other places to go. I would say my job would be absolutely perfect if I didn't have one, because it would mean that young people were already resilient enough to make sensible choices and weren't getting to a position where the choices they were making were being detrimental to their health. Not quite there yet. Give me another year. The outreach bit, so the engagement bit is A big change for adult services, it's a youth model for adults. So we go out into the community, we find those people who've dropped out of service, we find those ones that are a little bit chaotic. We go and work with the Health Outreach Project to go and find the ones who've kind of fallen through the gaps, who turn up occasionally but their lives are so chaotic because they're sofa surfing or sleeping rough that they don't remember they're supposed to come 2 weeks on Friday for an appointment to see the doctor. So we'll make sure that we get out there and we find them. And we'll also look at finding ways to get different people through in different ways. So we're setting up drop-ins in all of the hostels around Ipswich, and that will go county-wide. We're going to have 2 buses, and we're going to go out, and so we're going to go and work with the sex workers actually out where they are, rather than expecting them to come in, because they work quite antisocial hours. And so what we want to do is we want to find a way that works for them, because if we say, yeah, turn up at 9 o'clock on a Monday morning, they're going to tell me to piss off, because they aren't going to be there. So this is the Recovery Academy. For adults, once they come into service, we have to find something for them to do. Now, there are bits of it that we will do for them, and there are bits of it that we skill them up to do themselves. Because at the end of the day, what we want is we want them to go all the way through to there, go away, and never come back. So what we do in here is we have different stages. The yellow stage at the bottom is basically an open access. If you want to come in and find what we do, if you want to come in and have breakfast, there's a lot of food involved in this. If you want to come in and just kind of, catch up, find out what we're doing, have a cup of coffee, you can come in, we'll do harm reduction, we'll look at where you are at the moment, but there won't be that, right now you're here, you have to stay. So that means it's much easier for people to learn what the model is, learn how they can be engaged, and feel a little bit more secure. Because I know for me, one of the hardest things is walking through a brand new front door, regardless of what service it is, even if it's my dentist. If it's a new place to go, I'm quite anxious, and if you haven't noticed, I haven't got my self-esteem's all right. I'm all right. Not always great, but I'm all right. So we go from the yellow right the way through. The blue is a little bit more structured. So that's when you're going to be doing your mindfulness, your CBT, all of that kind of stuff, your group works. So you're going to be sharing your experiences and you're going to be getting support from other service users. The orange bit is for those who have got to a point of abstinence. So the idea is that those people have made a choice, they've got to a point where they're not using anymore and they want ongoing support. So people can be up and down in this model, they can go round and round in this model. And then the top bit is for people who've come all the way through, who've been abstinent for some time and then kind of either want to put back, so we have the ones who come and be volunteers with us and support groups and set up groups on their own, or they're the ones that we support into something bigger. I think that with any service, people can kind of get a bit stuck and feel a bit safe. So my perfect idea is that once we've got them there, we skill them up to have the skills to go and support other agencies and other voluntary places, so that their experiences as a drug user or an alcohol user can give them the skills to go, do you know what, I could go and support an elderly person who's trapped in their home because they've got no way of getting out, because I remember what it was like to be lonely, but I don't want to stay stuck in the same field. And then the end bit, that's this, getting them out, pushing them back out into the community. So we have things like mutual aid, which is your 12 steps, and the other varieties of that. We're working with lots of different agencies, as you saw at the slide at the front. We have partner agencies, so we have Suffolk Family Carers, who are going to be working with us really closely, and all of our affected others. So affected others in this setting is any young people who are affected by somebody in their family's substance misuse, whether it's a parent, whether it's a brother, a sister, whether it's grandparents. Suffolk Family Carers are going to be supporting those people in a really specialist way to make sure that the harm done is as minimal as possible. We're also working with Iceni, and I won't go on too much about that because there's somebody else who's going to chat about that in a bit, so I'll leave it up to the experts. But in Suffolk we talk about hidden harm, and hidden harm in Suffolk is something that the public health are trying really hard to find out how much there is, but also find out ways to limit it. So hidden harm in Suffolk talks about substance misuse, parental substance misuse, parental mental health issues and domestic violence. So there's a lot of work that goes on because we recognise that those 3 toxic things can impact massively on how well a child can develop and go on to getting on in school, having friends, and becoming a rounded adult. The model in more detail, just in case you needed to know. I just like clicking buttons, really. So this is Ipswich. I just forgot to change the thing at 8:30 this morning because I forgot to do this. So basically this is what we offer at the moment in Ipswich. The Ipswich hub is at Civic Drive, which is the St Matthew Street roundabout. Horrid building on the corner. Don't come and visit us there. We're moving in September. Come and visit us then. So basically what we do is we're open for service users to come in between 10 and 3. That means that they can just rock up. If they've woken up on a Monday morning and thought, I don't know what happened that weekend, you can just come in and have an assessment. Someone will be there, fill out the paperwork, and we can start their process through. We're open evenings as well. Once we're in our new building, that will be a lot more evenings. We want to be 7 days a week evenings. We're open on a Saturday as well. Ipswich is really quiet on a Saturday, whereas in Lowestoft and Bury, they have loads of people who turn up. If you ever want good cake, go to the Lowestoft service on a Monday because the service users bake all weekend and you can turn up and there's just a fridge full of cake. That's why I always book Mondays as my Lowestoft day. So, and the Connect Extra is for service users to look at how we get out into the community, how we make sure that people understand what it is that we do, but also the journey that people have been on. You don't have to have had a story, but you just have to be able to understand people's journey to be able to understand what it is that we do. We do offer group works. That will be getting more and more, but if people can find support from their peers, then their recovery is more likely to last. We do prescribing, so that's all of your scripting, so people who are coming off drugs might have a medical intervention to support that. But we also do a lot of work around harm reduction, so BBVs and that kind of stuff, blood-borne viruses, to make sure that if people are still making choices that are detrimental to their health, we can support in any way we possibly can to limit those. And naloxone, if any of you have read the paper a couple of weeks ago or watched the news, there were 5 overdoses that happened in Bury St Edmunds. They were drugs that basically, there was adulterated crack and heroin. These people took those drugs and they overdosed. So one of the things that we're looking at doing is giving out naloxone. Naloxone is, if any of you have watched Pulp Fiction, boom. So basically the idea is that it stops people from going into overdose, which means that what happens when you take depressive drugs, it slows your breathing and your heart rate down to the point where they can't work. And the idea is naloxone will counteract that so that we can hopefully save some lives. So that's done with training and hopefully in partnership with Red Cross, so that we can support service users as well as parents and carers to feel more in control of that situation, because I can't think of how I would cope in a situation like that. I think I'd probably be quite scared. So today was about dual diagnosis, and I know I've rabbited on for quite some time now, so I'll shut up in a minute. But it's probably one of the areas that is most complicated and most confusing for mental health services as well as drug and alcohol services. We know that there is a correlation. We quite often see people coming through who we say, oh, there's something else going on here. I know they're self-medicating, I know they're doing this because there's something else going on. But they're so caught up in their drug use that when you take them to mental health services, they're like, oh, we can't tell what it is yet because they're using drugs. So for me, today is a kind of, we know that there's a problem. We're working really hard to find ways to better communicate our needs with mental health services, but also finding a way to keep the client in the middle of what happens so that we can join up better in what we do. There will always be, unfortunately, this kind of quite sticky area, because you can't deal with mental health problem if it's actually caused by the drugs, but you can't take away the drugs because the mental health problem gets worse. So that kind of jigsaw is really complicated. Turning Point have a big clinical team behind them. They have lots of expertise in this field. They work mental health across the country. And so we're really lucky in the position that we're going to have people at the forefront of the service that we do who talk mental health, who can make that an understandable language for us stupid drug workers to be able to understand, but meaning that the service user will be kept much more at the heart of what's going on. And I'm really, really excited by that. So that is, right, let me quickly flick. Look, here we go. Suffolk Family Carers, this is what they're going to be doing. Iceni, just quickly, that's what you'll see more of this. And air sports, so I said that I'd talk about air sports. There's a million tiny, tiny bits of writing on here. But if anybody desperately wants these slides, I'm sure that we can get them out to you. The idea for air sports is air sports work with anybody aged between 18 and 25. They're going to go across the whole county, and they, strangely enough, use sport. It's in the name. And the idea is that they work with those people who don't think that they've really got a problem, who don't recognise that they could have support, that are probably smoking spliffs a couple of times, 3 times a week, but haven't really noticed any bad side effects, and so keep it going. And the idea is that they use the sport to find a way to engage those people, to be able to educate those people in the setting that they're in, but then if they need ongoing support, to then funnel them through to us. So on the 24th, I'm going to get that right, of June, they're in the marketplace in Ipswich. We're having, for part of Recovery Month, we're having an event. It's from 10 till 4, and all of the services that work with us, we work with Turning Point, to help and support adults and young people across the county with drugs and alcohol, and probably health and mental health as well. We're having a big event there. So if you want to come and see what air sports do, come along. They're going to be there doing salsa dancing and boxing and loads of other stuff. Suffolk Family Carers are going to be there, NSPCC. There's going to be lots of different agencies, and it'll be an opportunity for you or other service users or other professionals that you know, or anybody, to come along and find out what it is that we do in a little bit more detail. So, if you want to refer in, if there was a reason that you wanted to refer somebody in, if you wanted more information, if you wanted to phone up and ask to come round and have a look and see what we do, the SPOC number, that number can be given to anybody anywhere. Single point of contact. It's got nothing to do with the really cool sci-fi programme. Des was stated about that. I had the uniform and everything, but I'm not allowed to wear it. Give that a ring. 24 hours a day, 7 days a week, there will be somebody who answers that phone. And it is, you can pick it up and say, I've got this person, I need to make a referral, we will take that referral. You can be working and say, I've just found a person and they're in this position. Obviously, 999 is much better. But if you wanted some support, advice or information, then you can use that number as well, and they will put you in contact with somebody. Suffolk at Turning Point, if you have questions and you want to email them, do that. It goes to the same person as the SPOC at the moment, and it will get funneled out to somebody who can answer those questions. And if you needed a member of staff, name, and then, so I'm Ruth.Croft at turning-point.co.uk. So if you know anybody who works in drug and alcohol services, you can just start sending them random emails now, can't you? But that is who we are, and that is what we do. So thank you for your time, and apologies it was incredibly whirlwind, but like I said, it isn't the most exciting part of the day because there have been some really inspirational talkers and speakers so far, but this is kind of the backbone. If we're talking about this, our service is going to be the one that offers that support.